Yeah, this machine and this therapy is something for which BioMed Hospital is quite famous. It's a so-called hyperthermic perfusion with chemotherapy inside the abdominal cavity, and there are many cancer diseases by which ascites or water in the tummy occurs, and this water is quite threatening as it makes the tummy distended, makes pain, loss of appetite and loss of breathing. And treating cancer inside the abdominal cavity has been invented about 30 years ago by the American surgeon Baker. And we are one of the few hospitals in the world who are doing this perfusion without an operation, only by inserting a little tube inside the abdominal cavity. Here you see this little tube. It's just about 1 or 1.5 millimeters, and of course it's inserted in a sterile manner, and before inserting the abdominal wall is a little bit anesthetized and locally anesthetized. Then this little tube is attached to these tubes. You know, this tube is bound to get the heat from this machine. You know, these curves, they heat up the water or the saline solution which is inside in here. And the other two are bringing the water into the abdominal cavity. Patient lies here, and the other one brings it back to the machine. And the machine pumps in a little amount by 48 degrees Celsius, which is about 106 Fahrenheit. And this temperature does not lead to any burning inside, but it really kills the tumor cells together with a little amount of chemotherapy, which, so to say, circulates from the belly of the patient through the machine and back again. And the whole treatment lasts about 2 hours. As I've already said, no general anesthesia is necessary, only a local anesthesia, and to stop, so to say, the water inside the abdominal cavity, one usually needs about 2 or 3 treatments of, let's say, in a distance of a one week treatment. So it's very effective, and no operation is being needed. Here you see what you need to insert this little tube. Of course, it's done in a totally sterile manner with little patches, with a sterile tube, with a special needle which is called the Veris needle, and so on. So you see, it's only a little hole which you have to make inside the abdominal cavity. The second point, or the second disease you can treat with this machine, is bladder cancer. There are many people who have recurrent bladder cancer, and after a certain time, after several months, usually the urologist says, okay, now we have to remove the bladder. But with this heating up machine, it is possible to prevent the removal of the bladder. A little catheter is inserted into the bladder, and then again, warm or heated up water, we usually use about 44 degrees Celsius, which is about 102 Fahrenheit. This temperature will also kill the tumor cells inside the bladder. So this perfusion is very effective and has helped many patients in the last 15 years since we used this hyperthermic perfusion.